Hi, this is Dr. Roy Kim. I just came back from New Orleans from PSTM, Plastic Surgery the Meeting, which is the annual American Society of Plastic Surgery meeting. I'm going to be talking about some of the latest technologies and techniques that I found interesting there. I ran into a company called Tissue and Cell Technologies. Now, this is a UK-based company that started about 20 years ago. They offer the ability to cryopreserve or save fat, and you can order it in the future. So this is how it works. As a plastic surgeon, I do liposuction harvest. I then send it to the company. They actually store it. They can store it, they say, for 10 years plus, although typically they're storing it only for a couple years because it gets used up. The interesting thing is that I can send large amounts of your fat, the patient's fat, to this company for preservation, typically about 3 liters, which is a huge amount. Now, when I'm ready for it, I have to give them a couple days notice, and they send it to my office or operating room, ready to graft, ready to inject. And remember, this is the patient's, your own fat, so there's really no tissue incompatibility. Technically, if I'm extracting fat the day of surgery, it's going to have 100% viability. They state that their cryopreservation techniques, it's about 85 to 95% viability, which is excellent for something that can last, oh golly, for like months or years. Now, why would a patient want to do this? Well, the reason why is, for breast reconstructive cases, we often do fat harvest, fat graft at the same time as surgery. If you need a revision, if too much of the fat gets absorbed, if there's a contour regularity, we'd like to do it again, but if you don't have enough fat or we removed it from your first operation, well, I guess gain weight or have another alternative. With this option, if we have extra fat from your first operation, it's saved. It's saved at their warehouse. And so I can order some and give it back to you, and it's your own fat from your first operation. I do see a very interesting future aesthetic application. Fat, as we know, has stem cells, and fat in general is a really good thing because as we get older, we tend to hollow, we tend to lose some of our fat in our face, and we actually lose stem cells, or the stem cells don't work as well. If I can get your fat from, let's say, a couple years ago, and I can inject it in your face, or I can do some magical processing, known as a nanofat facial, of course, and give you your own stem cells back, that's a very nice rejuvenating procedure. We already have the fat we removed from your original procedure, or we could just remove the fat and store it, and you always have a little of your own fat and stem cells ready to go to rejuvenate your face. What's interesting about this company is that they're ready to go now. They have a place in Dallas to process and store the fat. Next up is LipoSurg. This is a Swiss company that has a newer power-assisted liposuction device. Power-assisted liposuction, it's currently dominated by micro-air, and essentially it's a mechanical way of doing liposuction that allows the machine to be very consistent and extract fat in a very consistent, efficient way, as opposed to doing it manually, in other words, by my hand. LipoSurg is interesting because they actually have a great new base. You can use any cannula that you want from other manufacturers, and it offers 2 hand pieces, not just one. So if you have 2 plastic surgeons working, it saves time in the operating room. Next up is Adimate, which is a filter for the micro-air power-assisted liposuction technology. Typically with fat harvest, fat filtration, and then fat grafting, I have to remove the fat, and then the tech in the back table, or myself, or someone, has to actually treat or process that fat. The Adimate filtration allows me to suction out the fat. However, the filter automatically filters the fat while I'm sucking it out or removing it. Much more efficient, saves time, and the tech can just focus on not only assisting me, but also on making sure that the Adimate system is working, and when that specific canister's full, then can remove the fat. And we have high quality fat to immediately graft. This is a very cool on-the-fly way of filtering fat, and I do think that it's going to have a lot of applications in the US. Currently, it's actually not available in the US. They've done all the paperwork for the FDA. They are rolling it out in Europe, South America, Asia as we speak. Finally, there's a company called Abrea. They offer before and after software. What's interesting is that you only need a tablet or phone to actually use the software. So of course, you need to take a photograph, and right on the device, it can actually generate 3D imaging. You can alter your appearance and so forth. The reason why this is so interesting is because currently we either have 2 options. One is an option where you have to buy a very large piece of hardware, relatively expensive, relatively bulky, and that sophisticated camera is what generates the device you need a relatively bigger computer to run the graphics. The other more increasingly common option is to take some sort of photograph, take a couple photographs to generate a 3D image of a body, face, breast, so on. And you need a cloud attachment, in other words, internet connection, because the graphics are run through the cloud. Sometimes if your internet connection is not fast enough, or sometimes if it's just a lot of data, it's a little slow. With your Abrea system, they've figured out a way where the graphics manipulation is pretty fast. Since it's not attached necessarily to the internet unless you want it to be or save the information, the ability of maintaining your patient privacy, I think from hackers, is a little better. I've not really heard of a hacking case with cloud-based software in plastic surgery related to graphics before and after. However, you never know. And I do think it's another step to make your data more secure. Those are the companies and medical technologies that I found interesting at the latest meeting. Do you have any questions about what I just talked about, or have any other companies, maybe technologies that I forgot to mention? Please let me know. I think you'll like this video here if you enjoyed this one about technology. As always, thanks so much for watching.